So I'm back doing this a day later than I thought. I tried to do one before my next chemo session, but this time I literally was so happy on my last day before going back to chemo that I completely forgot. I shouldn't say completely. I remembered when I was in bed and went, I better not. So just had my chemo done. Not sure if I ever showed this before. This is the little bag of the chemo that they give you to take home. Looks like a little hand grenade or mango or something. So it does a slow release of chemo over 46 hours. I know I mentioned that before. And it goes right in. So this is literally me coming out of chemo a couple hours ago. That's the port they put it in. So, yeah, last week was tough. Last week was definitely tougher than any week I'd had before. The cold sensitivity lasted longer. My nausea lasted longer. And I've also found out I had this like Pavlovian response when I was driving up to the hospital on Monday to get my blood test. I started feeling nauseous when I got in the parking lot. And I had felt fine before that. It had been about a day and a half since I'd felt any nausea. But getting in that parking lot, it was really when I opened the door. I don't know if it was a combination of the sight and the smell, but I just was like, ooh, I'm not feeling so good anymore. But it did go away after I left, so go figure. I also had a meeting with my oncologist. So if I told this right, which I'm sure I did, way back after my colonoscopy, that doctor recommended an oncologist, or I should say assigned an oncologist to me. And then I saw him, and he explained, basically how I was going to do my procedure of getting my chemo over the coming weeks. Well, after seeing him, they assigned a different surgeon to me. So the original surgeon I talked to for maybe 5 minutes, because I really didn't need to talk to him until the oncologist got all the CT and, all the scans me to take a look at and get a better idea of actually where we're going to go. So after he saw my stuff, I got a different surgeon, and I hadn't talked to him since. So from what I had recalled, or at least what I thought, originally I was going to be 4 cancer medications for 4 weeks. And then they were going to drop me down to 2. Now, this was the first time I talked to my oncologist, and that's the way I thought that I'd heard it. And then after the 2, a couple of times, then surgery. And then determine whether I need chemo after or not. Well, when I talked to the oncologist for the first time, like I said, since the new surgeon, it was last Thursday, I believe, I brought that up. I'm like, hey, I'm going down to 2 medications. And well, which one am I losing? And he looks at his sheet and he goes, no, I don't show you. You're on the same stuff. God, that was depressing to hear. It was like, no. So, not only is nothing changed, but now next week, I think it's next week, next Wednesday, I'll get another CT scan done. And then the following Wednesday is my normal chemo treatment. I'll get that done. But they want to do a CT between this time and next time so they can see the difference from before. And that could give me a better indication of when the surgery will actually happen. It could be, he mentioned something about a 12 period cycle. And so I don't know where I would fall on that. Obviously, it'd be after 6 if, they do it at the test between 5 and 6. I would imagine they have to schedule surgery like that a little while out. But anyhow, the big news was I didn't get to go down from 4 to 2. And that was very disappointing. And then today when I go in to do the chemo, lady's like, we're putting you in this room with a bed. I'm like, okay, not sure why. I didn't need a bed before. And then she says, it looks like we got you for 7 hours. And I'm like, whoa, no. I've been here 4 times now. I've gotten 4 medications. It's been just about 4 hours, a 20-minute, then a 1 hour, then a 2 hour, and all the time between that it takes. And she's like, well, I'll get your nurse, but it looks to me like you're here 7 hours. I'm like, oh God, did they change that too? And I didn't ask the right question of, I asked if you were going down, but I didn't ask if we were going up. So I was angry inside. I was just like, that's crap. If I'm going to more, if I'm going to be here 7 hours, they should have told me. Or, not like anything would have changed. But as I found out, because remember, I think I did this before the original one. They thought I was going to be in there 7 hours. So that's why when she said 7 hours this time, I'm like, well, they originally said that. Can you make sure that it's really 7 hours? Or if it's really more like 4 with some leeway time that I could be here in case you need to do extra stuff or do it in a different something comes up. And that's what it was. It still only took a little more than 4 hours this time. And I'll tell you about the reason for that. But regardless, it was still pretty quick. So the first medication that I do, the first chemo, I thought was 20 minutes. It's really 10. Found that out today, or confirmed it. Yep, still got the cough. So the first one is 10 minutes. The second one's an hour. The last one they do the last 2 hours. So I'm in between. I just get the second one done, or I'm almost, let me rephrase it. I'm just starting the second one. And she tells me some of the symptoms, and she says if you get stomach cramps or start to sweat, let us know and we can give you this shot that they get put into the rest of the stuff, and it takes all the symptoms away. Well, I'd had that before, the previous 4 times, but it's like they say, one person's threshold for, let's say, cold is different than another person's. Whereas I go out, it's 55 degrees out and I've got a t-shirt on. My daughter, she has to wear like 2 jackets. So to everybody, there's a certain level of, I don't want to say threshold you have, but I guess it is some sort of threshold where you're comfortable or not comfortable. Well, I didn't know in those previous times, yeah, it was a little warm, but that can happen at work if the air conditioning is set too high. So I didn't know if it's necessarily a ton on me or a ton on the way that I was perceiving what I should actually speak up about. Like, oh, I got a little warm. Big deal. Well, today, she said, let me know if any have any symptoms. I'm like, all right. So we're 2/3 of the way done through the 1 hour medication that can cause this. And I tell her, she came in and asked, regardless, I told her, I said, yeah, I do feel a little like sweaty. And she said, anything else, any stomach cramping? I'm like, no, there, I'm fine. She's like, you know what, let me give you this stuff just in case. I wish I'd done it the previous 3 times or 4 times. This stuff, like, immediately made me feel normal again. So I didn't realize how much I needed it until I took it. So you better believe she even marked it down that I should have that every time going forward. So yeah, that's the update for this week. Not reduced medicine, surgery pushed out later, and then get that shot that they stick in with the liquid that gets rid of the sweaty feeling. So that really worked out good. I wish I could remember the name of it, but I'm just sitting there for my up to 7 hours, but really 4. So that's it for today. Like I said, last week was tough. I'm hoping this week will be better. I don't know why. Oh, actually, that I should bring that up. That's two reasons why it might be better this week. I've decided to use my daughter's best friend's. She works at pot selling plant. I know they don't call it that. It's not a commissary. I'm blanking on the name of it course now. But needless to say, she gave me some that she said this should take away any nausea you have. And then another friend of mine did basically the opposite. He gave me some CBD oil that has none of the effects of marijuana, just the healing properties. So I think between those two things, it should be a better week than last week. Last week was miserable. So we'll see. Thanks for watching. Talk to you later. Bye.